We're now going to be looking at our first treatment protocol where we're working with our pregnant patient who's in her first trimester of pregnancy. Now, a patient who's in her first trimester of pregnancy, we're talking about from conception up to 12 weeks. So anytime within that first 3-month or 12-week period, we don't have a lot of structural changes or changes that are taking place in the woman's body just yet, but I recommend that you have a pregnant mother come in so that you can assess her and correct any problems that you might find that she's carrying in her body coming into the pregnancy in order to prevent any increased symptoms as she moves into the latter stages. So our first trimester of pregnancy is mainly going to be an assessment protocol. You're going to take a detailed history of your patient, taking into consideration any previous injuries or any previous back or cranial trauma or any spinal history of pain or discomfort that she might have had going into the pregnancy. We're also going to assess the craniosacral system. Why? Because we want to be sure that the craniosacral mechanism is pumping and moving effectively in order for the pituitary to be able to produce and send all of the hormones that are going to control the pregnancy in order to be able to flow and move properly throughout the body and throughout the whole pregnancy. We're also going to perform a postural assessment. We're going to do that in a standing position, and we're also going to check other areas of the body such as the thoracic inlet, and we'll see how in subsequent trimesters making sure that the thoracic inlet is open so that fluid can circulate and the thoracic cavity can have the proper health and expansion that it can in order for fluids to drain, in order to prevent acid reflux, which can come later in pregnancy, and also in order to ensure that the diaphragm is able to move well. So we want to assess the thoracic region to make sure that if there's any dysfunction in this area, now is the time to fix it. We're also going to assess our patient in a supine position, and we're going to look at things like leg length discrepancy, misalignments in the pelvis. Now is our time to look for any structural misalignments in the pelvis and in the lower limbs and correct any problems in that area. It's also going to be important for us to assess the sacrum. Now we'll see throughout the course how the sacrum is very important. It controls vasodilation and vasoconstriction into the pelvis. So ensuring that we have proper blood flow into the pelvis throughout the pregnancy, making sure that the sacrum is well aligned and is able to move well into extension and into flexion is going to be key. Also, as the baby grows throughout the pregnancy, increasing weight of the baby is going to compress on the pelvis. It's going to compress on the sacrum. The sacrum is also an important energy center within a woman. So ensuring at the beginning of the pregnancy that any corrections that need to take place in the sacrum and in the lumbosacral area, it's best to do them now before she starts progressing into the pregnancy and the weight of the baby and increasing circulating hormones are causing edema or causing downward pressure onto the pelvis. It's a lot easier to correct the sacrum when a woman is still slim and not carrying that extra weight than later on. So let's take a look at our treatment protocol and you'll see exactly what I'm talking about. We're now looking at our assessment protocol for a patient who's come to you who's in her first trimester of pregnancy. Now, a patient who's in her first trimester of pregnancy for us means that she's anywhere from conception to 12 weeks. And so what we want to do is we want to assess various systems of her body to see whether or not we come across anything that needs to be corrected and that should be corrected now to ensure that as she moves throughout her pregnancy, she's going to be healthy and happy and comfortable and be in her best optimal health so that when she goes into her delivery of the baby that everything goes as smoothly as possible. So while your patient is still slim and she's not experiencing edema or changes in pressure within her abdomen as the fetus grows, now is actually the best time to be able to come in and intervene and correct any potential problems. So let's look a little bit at what we're going to start assessing when we're looking with our pregnant patient after taking a detailed history of her medical history, any potential past trauma or any potential past back pain or even any potential past cranial trauma. It's important to be able to identify these now because we know that the entire hormonal system that is going to control and tell the uterus what to do throughout the pregnancy is controlled by the pituitary gland, which sits on the sphenoid and which is housed within the cranium. So it stands to reason that ensuring that the cranial mechanism is functioning properly and is not carrying any residual torsions or leftover problems or blockages from any previous injuries, now is the time to be able to check for that and correct for that in any subsequent treatments during that first trimester if need be. So when you're assessing your patient, you're going to be first of all assessing for any compaction in the suboccipital area. You want to make sure that this zone is open. Why? So that not only can blood, the venous system, drain, but also so that the cerebrospinal fluid, when it drains down into the third and fourth ventricle, then has an opening to be able to exit. And we know that the suboccipital region, if it's compacted, can actually impede venous and cerebrospinal fluid drainage. So our first thing is to ensure that we have good space between the occipital base and the first cervical vertebrae. And if there's any misalignment in that sense, then you might need to correct that. And what I find in my patient here is that she's actually experiencing a bit of a torsion, whereby the right side of her occiput is sitting crooked and a little bit rotated externally in relation to her right side, which is rotating internally. So we have the beginnings of the sign of a cranial torsion. This means that she has good drainage coming down on the right side, but not so well on the left. So this is the type of thing that you'll want to correct during her first trimester of pregnancy. Secondly, we're going to check for overall functioning and amplitude of the craniosacral mechanism. So we want to ensure that the occiput in relation to the sphenoid bone has full amplitude, whereby they come together when they go into flexion and they come apart when they go into extension. So first you can assess your occiput on its own, and you can listen and feel for its degree or range of motion. In cranial osteopathy, we refer to it as amplitude. The occiput's ability to roll into extension. So sure enough, on this right side, where she is more internally rotated, the occiput does not have full amplitude. It's not able to rotate externally as much. The right side is very open. So there's some correcting that needs to be done in terms of amplitude of range of motion of the occipital base as it goes into flexion and extension. If we verify the sphenoid, we also need to feel for flexion as it goes down and extension as it comes back up. So it's not as easy to palpate and feel for the sphenoid bone because there's only a very small portion of the greater wing of the sphenoid that comes up that we can contact in the area of the temple. So you have to have some experience in cranial osteopathy in order to be able to assess and feel for movement of the sphenoid, but also this movement of the sphenoid in relation to the occiput. So I always recommend verifying the occipital base, the alignment of the occiput on the first cervical vertebrae, range of motion of the occiput itself, range of motion of the sphenoid, and then range of motion of the sphenoid in relation to the occiput to make sure that they are moving together in unison as they come together in flexion and as they come apart in extension. So assessing for these three aspects of the cranial mechanism and correcting them is going to be very important in ensuring, as your patient moves throughout her pregnancy, that the sphenoid is able to send those hormones that control the pregnancy down to the pelvis in order for it to be able to function properly. So doing a proper cranial assessment is going to be your first step in your assessment protocol. After having assessed the cranial mechanism within your patient, who's in her first trimester of pregnancy, it naturally follows that we're going to want to assess the sacrum, and the sacrum in relation to the cranium. So with regards to the sacrum, we're also going to check to see whether or not, first of all, is there good range of motion, And we're finding that she's actually a little bit stiffer on one side than she is on the other side. So there's also the signs of a bit of a torsion in her sacrum. And as a result, there actually isn't a lot of even mechanical range of motion and amplitude and movement of her sacrum. I'm able to bring it into extension more on this side, but not as much on the other side. So assessing the sacrum, correcting any misalignments or blockages within the sacrum and its ability to move into extension and into flexion, and also the sacrum in relation to the cranium so that they move together in unison in flexion and extension, is going to be important in order to be able to ensure that, once again, if the craniosacral mechanism is functioning properly, the cerebrospinal fluid that carries the hormones down to the pelvic area, telling the uterus what to do throughout the pregnancy, is going to be key in ensuring that that system is working well. So correcting the cranium and correcting the sacrum in the first trimester of pregnancy to ensure that the mother goes into her subsequent months for the health of the pelvis, for the health of the fetus, but also in terms of reducing any potential back pain later on. If you don't correct problems within the lumbosacral area at the beginning of a pregnancy, these problems can become aggravated and manifest and aggravate the mother even more as the weight of the baby grows. And this torsion in the sacrum, if not corrected, can actually lead to some subsequent pelvic pain. We're going to have strain on the ligaments, and we're going to have an uneven pressure down on the sacrum, which is going to aggravate the sciatic nerve unilaterally, more likely on the side where there's lack of mobility. And also to ensure that we have good vascular flow into the pelvis. Remember, we said that the sacrum controls the vascular flow, reflex into the pelvis. So ensuring all throughout the pregnancy, but especially at the beginning, that the sacrum has good flexion and good extension is not going to be a threat to contributing to potential miscarriage for the mother. So we don't have to worry about that contraindication. What it's going to do is it's actually going to help to optimize good blood flow into the pelvis to actually ensure that the lining of the uterus is receiving good inflow of blood and is therefore healthy, is able to nourish the baby, and will ensure a healthy pregnancy. After having assessed the cranium and the cranial mechanism, we want to be able to assess the thoracic inlet in order to be sure, first of all, that blood that flows out of the cranium that comes down into the thoracic inlet is able to flow freely, but also as your pregnant woman moves forward into other trimesters of pregnancy, her breasts are going to grow, there's going to be a degree of breast engorgement, and there's also going to be a challenge on her lymphatic system as the baby starts to increase in size and pressure and upward pressure on the diaphragm. So now is a good time, while your mother is still relatively slim, to be able to assess and ensure that there are no restrictions in the cervical thoracic fascia, and that there aren't any misalignments in the clavicle or anything that might be impeding proper lymphatic drainage into the thoracic inlet from the axillary area, but also any proper drainage from the cranium into the thoracic inlet. So when you're assessing this area, what you're going to assess for is you're going to assess, first of all, for any type of discrepancy in alignment of the clavicles themselves. You're going to want to assess and make sure that the clavicles have full range of motion, that they aren't compacted and restricted up against the sternum, that we don't have any type of compaction or problem with the sternoclavicular joint, and also to ensure that we have good thoracic movement in the anterior region of the chest in relation to the anterior cervical fascia. So you can see that as I just do a bit of a stretch and as I test her, there's actually quite a bit of restriction and tension through the anterior area, because as I pull down ever so slightly, her head follows. So you might need to work on opening up this area with whatever techniques work best for you. When I place my hand in this area, I also have my other hand in back on the corresponding area of the thoracic spine, And you can also test to feel for overall mobility in this area, just to make sure that we've got good range of motion so her thoracic spine moves well. If not, you might have needed to work on releasing any type of hypomobility in the upper thoracic spine. But one thing that we notice is that there's a little bit of tension and downward drag on the anterior fascia. And this is something that you would want to work on in order to open up all of the areas that feed into the thoracic inlet. The next part of our assessment is going to be looking at her from a postural standpoint in a standing position. So we know that our bony landmarks that are going to be important for us to verify are going to be the occipital base, the acromion of the shoulder, the iliac crest, and the lower limbs. We're looking at her spine from a side view in order to see whether or not there's going to be any corrections in terms of her thoracic kyphosis and her lumbar lordosis that are going to need to be worked on at the beginnings of her pregnancy in order to ensure that as she moves into later stages, any problematic areas are not going to contribute to further problems later on. So as we look at our patient here, we can see that she has a bit of a scoliosis. So as a result, we can see how in the abdominal area, she protrudes a little bit forward and her thoracic spine is actually quite flattened. So she's actually lacking a certain degree of thoracic kyphosis. Her lumbar curve is good, but we're going to need to work on her and do some corrections in order to ensure that her alignment is proper. Notice also how she has a bit of forward head posture. And when we work and we check the thoracic inlet, sometimes we find that there's some tension in the anterior fascia, and this can also be contributing to forward head posture, which can cause reflex tension of the muscles in the suboccipital area. And remember, we said that this is an area that we want to be able to open up and ensure has proper drainage as your patient progresses through her pregnancy. So as we look at our patient, we can see that we have some tight sternocleidomastoid muscles also, a bit of forward head posture, a bit of anterior tilt with regards to her abdominal area, and a little bit of discrepancy with regards to her hips, whereby she's tilted a little bit more on one side than the other. If I get her to turn with her back to us, we can see that she actually has very good overall posture, good core strength. Her shoulders are even, but we can see that how there's a little bit of torsion in the lower thoracic area affecting the thoracolumbar junction. And we'll see in subsequent chapters how this area is in a reflexive area that's very important in terms of its neurological control and input into the pelvis. So we see that because of her scoliosis, we're going to need to work on releasing some tension and torsion in this area, and also do what we can to try to correct her hips, because we can see that indeed she's a little bit higher on one side than the other. So doing a standing postural assessment from the side and from the back are going to also be an important part of your assessment of your pregnant patient in her first trimester of pregnancy, because we're looking for pre-existing conditions or things that need to be corrected now in subsequent weeks before she moves on into her pregnancy, and any potential misalignments start contributing to pain or discomfort later on. Now we're going to perform a lower limb assessment on our patient in order to look to see whether or not there's any leg length discrepancy and any misalignment with regards to her pelvis. So when we check the lower limbs, after having checked the suboccipital region, where we were looking at that as an area in which we're going to be checking for levelness, we've also checked the shoulders and hips. We're now looking at the lower limbs, and so specifically what we're going to do is we're going to look to see whether or not the malleolus are aligned and whether or not we have any leg length discrepancy, which might be an indication of any type of torsion or anything off in the pelvic area that would need to be corrected. So when I verify my leg length discrepancy on my patient, I find that she's even, and yet she has quite a bit of external rotation in one leg versus the other. So there's a little more tension in rotation in one leg versus the other, and this is a sign of some type of myofascial torsion within the leg or any kind of tension coming up through the hip area that would need to be corrected. So verifying the lower limbs after you've verified the cranium, the sacrum, and the hips is also going to be an important part of your assessment of your newly pregnant patient in her first trimester.